All right. Well, thank you all for joining us tonight, and thanks very much for Reh-Fit for the invitation. I had the opportunity to visit Reh-Fit a few years ago, and it's a great facility, so I was more than happy to talk to them, the individuals who are involved with that. Today I'm talking about exercise and cancer. I'm going to focus on some new guidelines that were published in 2019 and then kind of embed that with some practical advice. There's also lots of time for questions afterwards. So feel free to hold on to your questions and I'll be happy to field anything. So the structure of tonight's presentation is really handling the top 5 questions I get consistently when I start talking about exercise and cancer. The first one is like, is exercise and cancer a thing? Like, do people do activity when they're on cancer treatment? The second is, well, is it really safe for people during cancer treatment? The third is the question that I get a lot is, will exercise reduce the risk of the cancer coming back? So for individuals that have had a cancer diagnosis, how will exercise play a role potentially in reducing the risk of the cancer returning? What counts as exercise is usually number 4. In the interest of time today, I'm going to skip that one. We can come back to it in the question period if anyone wants to. And the last one is, well, that's great information. Thanks. I'm sold. What do I do now with that information? So question number 1, exercise for people with cancer, a lot of question marks. So while I'm talking to individuals who are involved with Reh-Fit, so I'm going to think that a lot of you are interested in activity already and potentially have been doing it on your own. The one thing with cancer is that during cancer treatment and after cancer treatment, exercise wasn't really part of the treatment approach up until about 20 years ago. So while heart disease and lung disease had rehab programs that people just were referred straight to, there was a lot of concern whether exercise really had an important role to play in cancer treatment. The thought was that the treatments themselves were pretty challenging, and so people really needed to rest and recover and sort of allow themselves to be able to withstand the treatments, and that exercise might be an energy drain. What we quickly realized when we started thinking about that with more detail is that when you are less active, you do lose a lot of your muscle strength, some of your physical function, your cardiovascular function, and so people were really getting quite deconditioned during cancer treatment and found it really hard to bounce back. So we started to investigate if exercise could be part of the cancer treatment journey. And what we found is that really there was a place for exercise to help people maintain their physical function, keep their muscle strength, and allow them to sort of withstand the treatment, but also not to lose a lot of their physical function at the same time. There's still a lot of questions around this, and there's a lot we still need to research, but that's generally kind of the backstory of where exercise fits. And the question then is, well, do we need to spend a lot of time on this? Maybe people are getting active after their cancer treatment and we don't have to worry. And this is a great study that came out quite a while ago now. It's based in the US, but it was a population level survey. So they just sent it out to a representative sample in the US, and they were able to identify those people that had cancer in the past, had not had cancer in the past in blue, and then those that had had cancer, whether it was less than 5 years since their diagnosis or more than 5 years in their diagnosis. So the red is less than 5 years, the green is more than 5 years. And what was consistently shown is that for those individuals who had a cancer diagnosis compared to the blue bar, which hadn't, a lot of people had difficulties with participation, so things like doing chores, or reported some physical limitations. So about 50% of people, regardless of how long ago their cancer diagnosis was, reported they had limitations in things like walking a quarter mile, standing up from an armless chair. So I would argue that exercise can address a lot of these changes, and if we're able to provide exercise for people, we can improve this graph and allow people to get back to their full physical function afterwards. So in 2018, a group of international experts from around the world met to discuss what the current physical activity guidelines for cancer were and how those might be updated to be current. So you can see here there was a lot of partners from the US as well as from around the world. I was the representative from the Canadian Society for Exercise Physiology, also known as CSEP. And I don't know if you can see my mouse, but I'm circulating it here. It's on the kind of the top right, CSEP. And the reason there's an individual who looks like a British beefeater in the front of the picture is the hotel we met at had a theme of written, and that individual was the door person, so we saw him quite a bit, and we thought he jazzed up the photo a bit. So what did we talk about at this meeting, and what did we decide? So the 2018 meeting became the 2019 guidelines. And so the first guidelines for cancer, for individuals with cancer and exercise came out in 2010, so still pretty recent. And what those 2010 guidelines said was fundamentally to avoid inactivity, so get up and moving as soon as you could after surgery, try and keep as much movement as you could throughout the day during your cancer treatments. The second recommendation was the aim to achieve 150 minutes per week of aerobic exercise and 2 sessions a week of resistance training for general health. So I imagine if any of you has attended other of these presentations, that might recognize that this is the current physical activity guidelines for health for Canadians. And here it was for Americans as well. That was the only thing we really could say in the 2010 guidelines. We didn't have any evidence to suggest there should be anything different. We weren't feeling like they were perfect, but there was no evidence to say it should be more or less. So in 2019, we still felt that those held. Avoiding inactivity was the primary thing. And potentially once people had finished treatment, they should aim to achieve the current physical activity guidelines for general health. The one thing we did add, though, in the 2019 guidelines is we had more research evidence to provide some information about what amount of activity might help with the common side effects that come with a cancer diagnosis and cancer treatment. So this is the piece that was new. So what we found was that there's research evidence to show that exercise helps with the following cancer treatment-related symptoms. So there was randomized controlled trial evidence. So whether people were randomized to be active during their treatment or sort of maintain their usual lifestyle. And enough randomized controlled trials, they were able to put them all together into a synthesis called a meta-analysis of all of those trials. And what we consistently saw is that being active during your treatment helps with cancer-related fatigue, health-related quality of life, physical function, anxiety, feelings of depression, sleep, potentially management of lymphedema, I'll talk about that one specifically, and also bone health. And what we found is that the bar was slightly lower, that 150 minutes per week was now more like 90 minutes a week. So what we saw with any of these different outcomes, so if you were having difficulty with cancer-related fatigue, aerobic activity of 30 minutes 3 times per week, so if you do the math now, it's 90 minutes, was showing a benefit for feelings of cancer-related fatigue. Or resistance training alone was also helpful for cancer-related fatigue. So you could pick which one you liked better, or what equipment you had, or what you preferred. Or the combination of two might also be beneficial. So here you could do 20 minutes of aerobic activity plus resistance training and also see a benefit. What these colored dots at the bottom are trying to show is what outcomes up here were shown to improve with that amount of activity. So here, if we do our color coding and look across, aerobic activity about 30 minutes 3 times per week was beneficial for all of the outcomes with the exception of lymphedema and bone health. If you wanted to improve bone health, you really had to do resistance training. And that's how the kind of figure was trying to work. With lymphedema, it was a slightly different message. And so for individuals who are unfamiliar, lymphedema is a swelling in breast cancer is typically of the arm on the side of surgery because lymphatic nodes or lymph nodes in the armpit can be disrupted with surgery and radiation. And so there's sometimes difficulty with clearing the lymphatic fluid or fluid from the arm, and there can be arm swelling. And what we saw with these guidelines is that we actually showed that exercise didn't increase the exacerbation or make lymphedema worse if you already had lymphedema. And that was specifically for resistance training. So, second question, is exercise safe? This is good. It sounds like, there's some potential benefits. I might want to use this. What about safety? So consistently across the board, the randomized control trial evidence, all the information we had, really showed that exercise is safe for cancer survivors, both during and after treatment. There are some exceptions, and if you do have questions, if you are someone who's experiencing cancer right now and undergoing cancer treatments, certainly talk to the nurse practitioners you work with, the nurses, the physicians, if you have any questions about whether exercise is suitable for you. There are some general guidelines, and I've given a suggestion here from the Canadian Cancer Society. This is their website that talks a lot about exercise. And what it basically gives is some general prescriptions here, some safety precautions to think of specific to individuals who are on cancer treatment or have recently completed cancer treatment. So things like anemia or very low red blood cells, or if you're having difficulty with some of your blood counts that are taken during chemotherapy, like potassium and sodium, if they're not normal, talk to your healthcare team and sort that out before you engage in more activity. In some cases, if you have low white blood cell counts or have a weakened immune system, avoiding public places is a good idea. Gyms is one example. Obviously, Reh-Fit is kind of a unique setting where they are used to accommodating a wide variety of people, and probably cleanliness and making sure people with immune compromise potentially can be in a public space is probably a focus there. Sometimes people have difficulty with balance. There's a lot of neuropathy or tingling and numbness in the hands and feet. So just being careful if you are feeling like your balance is a little bit off. Try the bike, maybe instead of a treadmill. In individuals that have things like osteoporosis or arthritis or things like that, there are some concerns if you have bone health issues around some resistance training. So again, talk to your healthcare team. And then things like swimming pools are really difficult on the skin, potentially during radiation treatment, because the chlorine can irritate the skin. Sometimes people have portacasts or ways to provide the chemotherapy that are kind of in place during the chemotherapy. They stay, they're injected, they kind of cap them off and they just uncap them. There's some potential around that with swimming too. So if you have questions, I'm happy to answer those. And if there are any exercise professionals on the call, I just want to highlight the 2019 roundtable did give some specific guidance around how to use the guidelines, but apply them in certain cases. So if there is a case where there's bone loss and bone metastases, there's a section on that that gives a little bit more information. And the same for this list here. The reason that symptom clusters and sun safety are highlighted is those were new for the 2019 guidelines. We've updated all of these for 2019, but those were new categories. What that just means is symptom cluster is that commonly, while we were talking about how do you treat fatigue, how do you treat anxiety, some of these things commonly present together. So just some guidance around where to start. And sun safety, potentially during and after chemotherapy, some people are more sensitive to sunburns and the sun. So just making sure good sun safety, hats, sunscreen, all the things we know about are used as well. The last piece around safety is, well, our clinicians, our oncologists and general practitioners and nurses, they do see the benefit of exercise, but they're always a little bit worried about providing encouragement if they don't feel like they know enough about you or about exercise. And so a big piece of the 2019 guidelines was to develop a system that would help your healthcare team get you to exercise resources or encourage you to exercise. And so the team used what we called the exercise as medicine approach. And what it was asking the healthcare team members, so physicians, nurses, to assess people's current physical activity amounts with a very simple question, advise them that these guidelines I just presented exist, and refer people to whatever programming in the community might be suitable. And if for anyone that is been through the cancer journey, the distress screening, there's a thermometer that's used a lot around Canada. It's kind of a similar approach there, that you respond to the thermometer, you gauge kind of where your distress is at, and then based on that number, you may be provided different services based on that. That's the same idea that we used here for exercise. The biggest challenge is, of course, refer well. Where? So, individuals living in Manitoba, and especially in Winnipeg, have the Reh-Fit Center. Not everyone is so lucky to have such a space. And so what the group did is we now have a website called Moving Through Cancer. And so this is aiming to be a registry of cancer-specific exercise program around the world. Right now, it's really focused in the US, because they started it. We've added Canada in slowly, but the idea would be if your healthcare team says, hey, you know, exercise might be beneficial for you, the idea would be that exercise programs in your community, you could look here and find what might be a fit. There are some limitations to these guidelines. I just have to make sure I put this in there. All the things I talked about how beneficial exercise is and how safe it is, the challenge we always have is that the majority of the research that we can look at is still in the two most common cancers, early stage breast cancer in women and prostate cancer in men. Those are the most common cancers. They have the most research. So every time you think about other cancers, sometimes we're applying what we know from breast cancer and prostate cancer to other cancers. So it has some limitations. There's very little information in advanced cancer. So individuals that have more advanced cancer or metastatic cancer, we need kind of more information and guidelines for those individuals than we could provide in these 2019 guidelines. And everyone always wants to know, well, how much do I need to do or how little? We don't have a lot of head-to-head comparison trials where we tested, 100 minutes versus 150, and we found that, only 100 is needed. We still need a lot more research on that. And we didn't have any information around a lot of different types of exercise like yoga or Tai Chi or things that people find really helpful and interesting. We didn't have enough evidence to really incorporate those into the guidelines. So just a few caveats. Question number 3, the big one, will being active after my cancer diagnosis reduce the risk of the cancer coming back? So I'm a scientist and we always like to, be very clear with our evidence. And so there really are very few studies available to look at whether people after their cancer diagnosis, if they're active, that reduces their risk. The studies that are available are observational, which means that we ask you about how much activity you've done and follow people over time. That's different than if we randomize or we do an experiment where we ask you to exercise or not and then follow you over time. The difference is that if you have similar risk at baseline and we give you something different like exercise and we want to show it's a benefit, we should see a difference between the groups at 10 years in the future, for example. There are 2 randomized trials underway. I believe that Winnipeg is involved in the Challenge or CO21 trial. So if anyone on the call has colon cancer or has had colon cancer treatment, maybe you're involved in the trial, I don't know. But what that will do is it's randomizing people to 3 years of an exercise intervention versus kind of just maintaining your usual lifestyle, and current physical activity guidelines are given to you. And we're following them over the next 3, 5, and 10 years to look at whether the cancer comes back in one group versus another. So that's very exciting evidence. We're looking forward to that soon, I think. It also is a bit difficult to assess this question because there's lots of different cancer types. Even within a type of cancer, breast cancer, there's all sorts of different kinds of breast cancer, and people have different stages. So how kind of small the cancer is to how big, and a lot of different activity combinations. So it's going to take a little bit to unpack this, but the take-home message is that exercise lowers your risk of all sorts of other chronic conditions, diabetes, heart disease, helps with your mood, all these other things. So that's why I really promote activity after your cancer diagnosis is really beneficial for your health. Whether it impacts the cancer coming back or not, we don't know at this time, but it has so many other health benefits that it's worth doing. In terms of the actual data on this that we do have from observational studies, as part of the 2019 guidelines, we reviewed what kind of activity decreases the risk of the cancer coming in the first place. So what you can see here is there's 7 common types of cancer that if you are more physically active versus less physically active, it reduces your risk of getting these type of cancers before from preventing those cancers, for lack of a better term. And the risk reduction, or how much it is preventative, ranges from 12 to 28%. Exercise post-diagnosis from observational research. So again, we're just following people over time. We haven't randomized them. There's a consistent relationship for breast cancer, colorectal cancer, and prostate cancer. That those individuals that are more active have a lower risk of the cancer coming back, which is cancer-specific mortality and all-cause mortality, so improving your general health overall. And that's the ranges of lower risk of the cancer coming back or dying of any cause. Again, everyone wants to know exactly how much I should do, and what we found in the 2019 guidelines is the exact dose of physical activity needed to reduce the cancer-specific or all-cause mortality is not yet known, because you have too few studies that have been conducted that have detailed data on the risk associations for a specific dose of activity. So there wasn't enough precision in the observational studies for us to really start knowing the exact amount of activity. Question 4, which is question 5 really, but I'm skipping 4, so now it's question 4. How do I get started? So I feel like because you're all here, you're already kind of dedicated exercisers or curious exercisers. So this might be not new information for you, but I'm putting the cancer lens on top, and we'll see if there's anything new or different that comes out for you. So the general advice to get started, especially with a cancer diagnosis and cancer treatment, I would encourage you to speak to your doctor, whether that's a GP, an oncologist, your healthcare, other members of your healthcare team, like a nurse practitioner, just to say, hey, I want to be active, any concerns you might have. Again, like anything, starting slow is a great place to start. Typically, individuals who are having cancer treatment, it's not fun. And chemotherapy, for example, is usually given in 3-week cycles where they give you an infusion, feel pretty terrible. You just start to feel well enough to then get your next cycle. And it's a lot of up and down. And so really just starting slow, doing something simple like walking, increase as much as you can on the days you feel good, or go a bit longer on the days you feel good. And it can go up and down, and that's okay. It's really just, getting out there. And people always tell me when we've run our studies that they always feel better after exercising, even if they didn't feel great to start with. They just went and they did 5 minutes and it turned into 10, and they felt better afterwards. Try to exercise a little or do some type of activity each day, even if you're feeling unwell. Even some gentle stretching, just get moving. It will really help. And if I don't have energy to exercise for long periods, you can break it up into several shorter periods during the day. I think all of us now, with being a bit confined to home, it's really, we all need the encouragement to every little now and then, just get up and walk around the house, change the laundry, do anything to kind of keep us from sitting in front of the computer or sitting in front of other things that we're doing when we can't be out and as active as we're used to doing. So that still holds in this case too. What counts as exercise or physical activity? Again, this is probably preaching to the converted here, but anything that gets your heart beating a little bit harder, cause you to breathe a little bit faster. And we used to talk about it had to be for at least 10 minutes. That's gone now. No minimum amount of time. Any movement is good. Just get up, get moving. And the more you can get a little bit of a sweat on, a little bit breathing a little bit harder, you're going to get that benefit of being active. The talk test is my favorite too. If you really want to try and get in that aerobic training zone and improve your cardiovascular fitness, if you can still talk and carry on a conversation with the person next to you with a bit of a breath in between, you're in the right zone of getting some nice aerobic intensity. If you can't get a word in edgewise, you're probably pushing a little bit too hard. And if you can sing like this little cartoon person, you could pick up the pace a little bit. It's a little bit too easy for you potentially. So you can use the talk test to get 10 or 15 minutes of really solid aerobic activity with that heavier breathing. Also, too, you're not alone in this journey. There's lots of people that have expertise with working with exercise in individuals with cancer. So I really would encourage you, if you have questions or concerns, you have local resources. So if you're concerned about aches and pains that are slowing you down, you're just not sure what's safe for you after or during your cancer treatment, find a physio. This is the Manitoba Physiotherapy Association's link. They have a little tab there, find a physio. You put your hometown in, and there's a list of people who are qualified, registered physical therapists who all receive training to some degree in oncology. That's part of our training. And there's usually, you can click on what you're looking for. So oncology is sometimes there. If it's breast cancer, breast health, and it will give you people in the community who you can go and see. If you're looking for an exercise professional, and typically the certifications that are well recognized in Canada are the American College of Sports Medicine Certified Cancer Exercise Specialist from ACSM, or the CSEP certified exercise physiologist, or certified personal trainer. So I'm sure that the individuals at Reh-Fit have many of these different credentials, but if you are going out into the community and you're just curious to try and understand, well, who could I see? These individuals are well-trained exercise professionals, and in some cases have additional exercise training for cancer. Also too, just in terms of kind of reaching out to your local community, Cancer Care Manitoba has an excellent resource, has lots of excellent resources. I picked one here, which is their video on managing fatigue. They also have a really nice PDF. This is, not a very nice link, but I just went on to Cancer Care Manitoba and put physical activity in the search box, and it popped right up. Great information on how to get started with exercise as well as healthy eating, and really good information about cancer-specific recommendations. So I would really refer you to that. So we're reaching the end of our time here. The take-home messages really are that exercise is possible, both during and after cancer treatment for most people. Physical activity has many health benefits, so I would encourage everyone to engage in some amount, moving throughout the day, trying to be as active as possible during cancer treatments when you're feeling well, and do a little bit of activity on those days you're not feeling as great to see if that helps. We do need more research to understand the role of exercise in reducing the risk of cancer coming back or cancer being a problem for going on to cancer-specific mortality. We just don't know yet, but exercise has all those other benefits, so don't let that stop you. Some exercise is better than none. So again, just moving more, getting moving, especially on those days you're not feeling great. And there are lots of resources to provide guidance and help. And I would suggest Cancer Care Manitoba as your first stop, or the people you work with at Reh-Fit. So with that, I will say thank you and provide time for any questions.
So again, Kristin, thank you very much from the Reh-Fit and myself. Hopefully we can keep in contact, and as guidelines change and people get into exercise a little differently from different conditions, we can work together. And thank you everybody for tuning in, and hope you have a wonderful evening.
Thanks so much for the invitation. Really nice to see everyone tonight.
Great. Thanks a lot.
Bye-bye.
Bye.